Good evening, everyone. Good evening.
Hi, Dr. Hilliard. How are you? I'm sorry, I'm trying to connect my camera. Just like
Oh, no problem. Good evening, Dr. Omar. How are you? Dr. Almadawi. I see you. There you are. Perfect.
great. Let me.
How are you?
I'm good. How are you? Thank you for having me today.
Oh, thank you so much for committing. I know your schedule was unbelievably rough. You're phenomenal. You got a tough schedule. We're the we're so thankful and grateful. I'm just gonna give it 2 minutes and then we'll get started, okay?
Sure, awesome. Yeah.
Thank you. I sent it on your text. Can you look on your text for me? It's on your text messaging, okay? All right. Good night.
So, Dr. Hilliard, do you mind me starting sharing my screen and just to adjust to make sure the PowerPoint looks okay and everything?
Absolutely. There you are. Click the yes. There you go. You see it?
I think I'm in.
You're
Okay.
in on my end.
Do you see my screen now?
Yep, you started sharing your screen. It says double click to enter the full screen mode. So you're there.
Okay. Oh, and I think
And then you know how to hit slideshow at the top.
hit
At
what's
the at the top where you have file, home, insert, draw, go over to the right to slideshow.
yeah, like this you
Oh,
mean?
you just started to make it show full screen.
Like this?
Yep,
Yeah.
yep, you got it.
Okay.
Fantastic. Okay, everybody, we're going to start on time. Good evening, everyone.
Good evening.
This
Good
is
evening.
also
Good
on the
evening.
YouTube. We have people watching on YouTube. We're so excited and so thankful and so appreciative that we actually have a cardiologist sharing his time with us because he's very busy. He works not just a set schedule, all over the clock at the hospital. Dr. Omar Al-Madawi is a third year internal medicine resident at MedStar Health in Baltimore, Maryland. In July, he begins his cardiovascular disease fellowship at St. Louis University in Missouri, working toward his goal of becoming a cardiologist. He previously served as a postdoctoral research fellow in pulmonary and critical care at Johns Hopkins Hospital. Throughout his training, he has gained extensive clinical and research experience in cardiology, critical care, and internal medicine with multiple peer-reviewed publications in high-impact journals. We can go on and on because I can go on high-level lipoprotein A and all of that talk, but we're not going to get into all that technical talk. He's brilliant. He knows what he's doing. And I thank God for him devoting his time to us tonight to talk about heart health. I'm gonna do a really quick prayer for our audience. This is our church community that's on Zoom. God, we thank you so much for another wonderful evening. Thank you for the healing in our bodies that you give us. Thank you for Dr. Omar, the speaker tonight, and his dedication to improving the health of patients. Thank you so much. In Jesus' name, amen. All right.
Amen.
Dr. Omar,
Amen.
you go ahead and roll. You go ahead and get started.
Yeah. Okay, let me share my screen again. I'm sorry
There
about
you go.
yeah. I still see some people coming in, so
You go ahead, people. Ed, I had to mute you. That's too much noise. I'll mute people if it's too much noise. Mute yourself if you know you're a talker or you have television noise. Thank you so much. You go ahead and start because people are going to consistently come in. We got people on the stream. You just go right ahead.
sure, awesome. So, hi everyone. My name is Omar Al-Madawi. I'm one of the medical internal medicine residents here in MediStar Health in Baltimore. I actually originally from Egypt, and I graduated my medical school in Egypt and came to the USA to do my research fellowship in critical care, and then did doing my residency now at MediStar Health. And in July, I'm joining St. Louis University as a cardiovascular disease fellow, so to be a cardiologist in the future. I'm really honored to be with you today. So let's start ahead. Our talk today is about cardiovascular disease prevention. And when we talk about cardiovascular disease, like what typically we're referring to is cardio, like which mean the heart, and the vascular system, which mean the arteries and all of that. So it actually, like, cardiovascular disease is a very broad term which we can use to include like coronary artery diseases, like when you have a heart attack, for example. This is basically the artery supplying your heart gets blocked and start having like symptoms from that. Even the arteries in your brain, which can cause a stroke, that's considered kind of like cardiovascular disease. If your heart is failing, like the pump function of your heart is failing, that's called heart failure. When your heart, instead of beating like 60 to 100 beats a minute regularly, you start having like funny beating, or beat like fast or slow. That's called arrhythmias. And also, like, if you have valve problems, it's also like considered a cardiovascular disease. And the list goes on and on and on. It is actually a lot of other diseases too, but just for we're talking about the common types of the heart diseases. So why prevention is so important? Like for you guys, like for everyone to know, like the cardiovascular diseases are the leading cause of death globally, and like worldwide, and even in the USA. Like the WHO estimate, like there is 17.9 million people die annually from cardiovascular disease. In the USA, in like 2022, we have almost like 700,000 people died from heart disease, which translates into one person die every 33 seconds from it.
Mm.
And it actually spans total death of like 1 of every 5 deaths in the US is from cardiovascular disease. And as here from the figure from CDC, you see like people like younger population, like 18 to 44 years old, have kind of like low prevalence, but as the age goes up, like to 75 and over, you have almost like more than 25% of these population have cardiovascular disease. So you can see as we age, we get more disease. Okay, so when we're talking about the prevention, what kind of prevention we're talking about? Basically, we mainly talk about like primary prevention and secondary prevention. So the primary prevention is if you do not have a cardiovascular disease, okay, if you don't have a heart attack, if you do not have a stroke, if you don't have a heart failure. We will work with you to prevent you from getting these diseases. So patients or people who doesn't have like cardiovascular disease, we try to prevent them from getting it in the first place. So we called it primary prevention. While for secondary prevention, if you got a heart attack, for example, or if you have heart failure, we work with you to prevent you from getting another heart attack or to develop like heart failure exacerbation, for example. And I will focus on in this talk mainly in the primary prevention because mainly that's what we are trying to achieve. And if you're already in the secondary prevention category, I like you should have already like established physician relationship and you're already seeing someone to do the secondary prevention. But again, like what are we preventing, correct? Like if we're doing prevention, we're preventing something like what are we are working on? It is mainly the risk factors, and the risk factors for cardiovascular disease are enormous. Like there are a lot going on, but let's say we have two kinds of risk factors. The one which we cannot modify, like I cannot give you treatment for it, basically like age, like gender, like genetics and family history. We cannot really control that this much. However, like other modifiable risk factors, which we can control and work on and further reduce the risk of diseases in the future. Some of these are like obesity, for example, diabetes, bad cholesterol, high blood pressure, smoking, alcohol use, healthy habits like eating like fatty food and stuff like that, physical inactivity, and of course, like some psychosocial stressors like anxiety and depression and many more to consider. So what our strategy for the primary prevention? We have either two strategies, like lifestyle modification, and we can actually do some testing and medication. So I'm not sure, Dr. Hilliard, is it like interactive session or can I ask questions or
Yes, they can ask, you can just pause and have them ask you questions. However, that's just fine.
I mean, like, can I ask them, like, can I just like, can I interact with them or like just talk?
You can. Everyone that's on Zoom can talk.
Okay, awesome. So for everyone on the Zoom, like what kind of lifestyle modification you can think of, which can help us like reduce like cardiovascular disease?
Exercise like aerobics.
Exercise?
Yes, like aerobics.
Oh, excellent. Yeah, aerobics. Yeah. Do you have an idea how many minutes or how much you should exercise every day or every week?
At least 150 minutes a
Well,
week.
that's so true. Okay, that's excellent. That's actually like what guidelines say, like recommend. Okay, other than the exercise, what do you think of? What other things we can work on, like in our lifestyle to reduce our disease risk?
I think your eating habits.
Yep, excellent. Eating habits, true. And do you know of any specific diets like they are recommending?
I would say like you were talking about fatty foods, like too much salt, not just fatty food, but too much salt, um, fried foods compared to baking your food.
Yep, that's so true and so good actually. This is regarding diet. So whatever you said is totally right. So we mainly focusing like on fruits, vegetable, nuts, whole grains, legumes, and lean protein. Usually, like we prefer like fish and chicken, like white chicken, like breast, because they are less in fat. Some diets we know of. It's called like plant-based diet or DASH diet or Mediterranean diet. I would say basically most of them like revolve around the same idea, but the plant-based diet actually you totally cut the protein in your like the animal source of protein in your food. And which actually like some studies showed like it's actually associated with lower mortality and lower cardiovascular disease risk. You try to minimize the fats the processed meats and the refined carbohydrates like sugary, like juice, sodas, and all of that stuff. And also try to limit like high sodium intake, as you said, like we usually prefer it to be less than 2 grams a day, like or 2,000 milligrams daily, because like salt is linked to increased high blood pressure, which in turn lead to cardiovascular diseases. And this is the picture of like Mediterranean diet. As you see, like it's full of like good source of fats like olive oils, fruits, vegetables, whole grains, tomatoes, and all of these good stuff. So some of the studies actually showed like the Mediterranean diet can reduce mortality, reduce like the cardiovascular events, is like heart attacks and all of that by 30%. So changing your diet alone can reduce your risk by 30%, which is a huge reduction. And again, like we should stay away from like all like the sugar beverage, like sodas and all of this stuff. The other thing we would like to work on the physical activity. So as you said, also like we should engage in 150 minutes per week of moderate intensity aerobic exercise. Or if you want only like to exercise less amount of minutes, you can increase your activity intensity. So by moderate activity, I would say maybe like brisk walking, like swimming, cycling, hiking, like gardening and all of these stuff here. If you want to go further, like running, for example, if you are able to, you can only do 75 minutes of this kind of activity. And also you can always mix and match. So you don't really need to do like 150 only if moderate or like 75 or vigorous. You can do maybe a mix of 110 exercise between moderate and vigorous exercise. And also this has been also linked to a very good outcomes in cardiovascular disease. For the weight management, the weight is also like so important. Losing as much as like more than 5% of your weight can improve the blood pressure, cholesterol level, glucose, and diabetes, and all of that stuff. So weight management is so important in our cardiovascular disease risk prevention. And as everyone is aware, we have like a lot of new medications which we can use now to bring the weight down, and they have very promising results so far.
I have a question.
Yeah, sure.
Why is it that women suffer so much more with heart problems than men?
Oh, actually, this is a very good question. I think I skipped it, so let's go back. Yep. So interestingly, like actually, like if you look at the statistics, it sounds men are affected early. So like man can get like cardiovascular disease early in his like age, like around 40s or 50s maybe. But women tend to get like cardiovascular disease later in their life, like 50s to 60s years old. However, have a worse outcomes. And I was reading about that. It's apparently, like when women present with heart attack, for example, they usually have like atypical symptoms or unusual symptoms. They will, instead of like coming with a chest pain, a very classic heart attack kind of symptoms, they will be coming with nausea and vomiting. And sometimes we miss, like sometimes this is being missed, but nowadays I think most of like the physician are very aware of this, and we try to work up every woman coming in with symptoms, which is chest pain or heart attack. So maybe this is why like some women have worse outcomes.
Okay.
I mean,
and also we now have women smoking again, and they're even picking up cannabis, cigars, everything else. We're running into a lot of that here lately, and not controlling their blood pressure. These high stress jobs, we have higher positions now that are more demanding. They finding out of so many factors now. Go ahead.
Dr. Omar?
Yeah, sure.
How much does exercise, how important is exercise in this management of heart conditions?
So I would say if you do not have a heart condition, like if you are a healthy individual, I would highly advise you to do like the 150 minutes because it's actually linked to very favorable outcomes and everything. So I would say it's very important if you're able to. But if you already have a cardiac condition, I think you may be limited. But exercise never is a bad thing, as long as you're able to do it. If you're able to exercise, you should try to exercise as much as you can.
Thank you.
But
Thank
of
you.
course, you need to check with your physician because every patient is different.
Okay, thank you.
Any questions so far? Any other questions? I mean,
Yes, I want to know what is, these QB exercise exercise they have out, do that help with exercising for heart disease? Does that help if you're disabled and you can't do the walking, can you use that instead?
oh, like
Is
you
that
mean the weight, like you mean like doing like weights or stuff like that?
it's
The QB bike, the leg bike.
leg, yeah.
The stationary cycling, the leg bike that they
Yeah,
have
sure.
for
I mean,
patients with
like any kind of cycling should be fine. Even if you look at this picture below you, yeah, cycling should be fine. Just do whatever you're able to.
Okay.
Thank you. That is
What
awesome.
I have a
Go
question.
ahead.
What about steps? Is steps good for a person with heart?
I mean, if steps actually one of the exercise which burn most calories, like it's actually very tough exercise to do. If you're able to do the steps, it would be great. But again, like if you have a heart condition,
Yes.
I would check with my cardiologist or like my primary care physician of what you would be able to do and what not. But again, I mean, steps is a good exercise in general.
You got to be cleared by cardiology. I know her.
Yeah.
You have to talk to
Yeah.
your cardiologist. Can only follow their prescription on
Yeah.
exercise.
Okay.
Any other
What-
questions?
What does it mean when your heart is racing when you're sitting down, not doing anything?
So like heart racing, like you mean like you have a high heart rate, so a normal heart rate would be around between 60 and 100 beats per minute. So your heart should be beating like between 60 and 100 beats per minute. If your heart is racing or you're having like higher heart rate, that's meaning your heart is actually may have some kind of disease or like you have some sort of cardiac disease. They mainly call it palpitations, and there are a lot of arrhythmias. Like it's actually called arrhythmia, like which is irregular heartbeats. So this has a lot of differential under it. Like it can be like atrial fibrillation, it can be abnormal sinus tachycardia, it's something called BVCs. So if you have such condition, you need to you need to see like a primary care physician or cardiologist to do
Okay.
like basic work.
Okay.
You get EKGs every year. So
I just had one.
yeah, right. So they would send you to cardiology if there was abnormalities.
It was.
Then you have to go to cardiology.
They didn't send me.
They told you you had tachycardia. What they tell you?
No, they didn't. She just said it was beating fast at that
Oh,
time.
okay. So that's tachycardia when it's beating fast. That means faster
Okay.
than normal. So that's what he's
But
saying.
she-
Anything, but she didn't refer you to cardiology.
No.
Okay, we'll talk about that offline because
Okay.
that's your medical. Okay.
Yeah. Okay.
Dr. Omar?
Yeah.
How important is maintain your proper weight according to your age and your height and so forth? How important is that?
I'm sorry, can you repeat the question?
How important is you maintain the proper weight according to the standards of what you should weigh?
We're talking about ideal body weight. How important it is
Right.
to have ideal body weight, not be
Right.
not be overweight or obese. How important is
Right,
that?
right. That's right.
That's what
I'm
he's talking
asking.
about. I know what you're asking. Go ahead, Dr. Omar. You can answer that.
Yep. So actually, again, it is very important because like weight management is like obesity or obesity is one of like the major cardiovascular risk. And again, like lowering your body weight by more than 5%, it improve like a lot of stuff, like it improve the blood pressure, the cholesterol level, the blood sugar, and it actually improves all the cardiovascular health. So I would say it's like really important. But I mean, like, how we decide if you are normal or obese? We usually like the most like common way to do that is doing something called body mass index. So we take your height in centimeter squares and we take your weight and sorry, I think I'm confused with me. So
Well, you got a BMI calculator now. You can just go online and hit
exactly.
BMI calculator, put your age and weight in, it does it for
Yeah.
you.
And the other thing, of course, like there are some new data coming out about like waist circumference. So we see how large is your waist, and actually nowadays we can check how much body fat in your belly, or like how the fat or the lipid in your body is distributed, which actually may affect your risk too. But I would say again, like overweight is very bad, and if you have the opportunity to lose some weight, this is super important.
Yeah, doctor, I asked that question because most time you go for appointments in the hospital, appointments, they weigh you, they check your height and see what the last time that you saw the doctor, what your weight was compared to the present time.
Yep, it's
You're right,
important.
Deacon. And what Dr. Omar is saying is that it's extremely important. Like we automatically, our computers calculate your body mass index, and that's based with your weight, your age, and everything. So we find out your ideal body weight, we get your body mass index, and you're right. We make sure that number one thing, lose some weight. We do
Yeah.
tell everybody that I'm losing weight myself, just personally. It's a story. I gotta lose weight now. I'm 10 pounds overweight. I put that on. I gotta get it off because it affects how I feel. I don't even feel as well. You feel better when you have a great body weight. When you're less than 30, when your BMI is less than 30, you feel better. You do.
Right.
You feel better. You feel great when it's less than 27. You do.
Right.
Thank you, Dr. Omar. Thank you, Deacon.
So moving forward, so the next thing in the prevention also, like if you are currently smoking, I think smoking cessation also like one of the most important thing. It's linked to heart disease, stroke, even the secondhand smoke like contribute to like heart attacks and coronary artery disease. E-cigarettes, some people would think it's safe because you don't take all of these bad fumes inside you, but actually also e-cigarettes are also associated with like cardiovascular diseases. The other, like quitting smoking has a lot of benefits, I would say. If anyone is smoking now, we have a lot of also medicines which we can use help you quit smoking. And actually there is a line by the CDC, it's called 800 Quit Now. If you call this line, they will give you a lot of resources and help you to quit. And also your primary care doctor should help you, like give you some medicine and help you quit like smoking. It is much easier than before, I would say. So
Yes,
what?
can I ask a
Doctor,
question?
Yeah, sure.
Explain again, but this secondhand smoke. You're not a smoker, but it's secondhand smoke. It's how bad that is for the person that's not a smoker.
I mean, I would assume it is less than if you are really smoking, but if you are comparing someone who is not exposed to any smoke at all, like he's not smoking and he's not exposed to secondhand smoke, it actually has better outcomes than the guy who's exposed to secondhand smoke. Even in kids, like being exposed to secondhand smoke is actually a bad thing for them.
Doctor,
And those of us who had cancer before, like, no, people cannot be around me smoking. That increases risk of reoccurrence of cancer. People with asthma, allergy problems, heart disease. No, you should not be smoking around them. Secondhand smoke is awful. They should not be smoking. Don't let people smoke around you.
Exactly.
Doctor, I have another question.
Yeah, sure.
How important is family history? Keep an eye on your family history.
I'm sorry?
How important is family history? Keeping a watch over your family history.
It is, I would say it is important because if like some diseases runs in your family, does mean that you may be at more risk of getting such diseases. So I would say it's important to be aware about it. But I mean, again, like, unfortunately, this is non-modifiable risk. I mean, it's good for you to be aware about it, so because it helped me as a physician to guide my thoughts into certain scenarios. Or like I would know, like, okay, or you have a lot of family history of cardiovascular disease, so you will be very likely having a high risk of cardiovascular disease. But can I do anything about it? I can work with you on other stuff to prevent you from getting cardiovascular diseases.
Dr. Omar, it also
Thank-
makes you more aggressive in your treatment patterns. Like if you know my mother had a heart attack at 50, you see my cholesterol just be slightly high. You're gonna say, get on a statin. We making sure we control your blood pressure. You're gonna be more aggressive with my care if I have a family history.
Exactly. And actually, I will get to this point. Thank you, Dr. Hilliard. I think this is like really important point, especially with the new word of like prevention in cardiology. We have like a lot of like new lipid molecules which we can check for, which I'll get to like very soon.
Thank you.
Yeah, sure. So for the medical interventions, what we can do, like for the primary prevention, it is the same as before, but like one of the most important thing is managing the blood pressure. If you have uncontrolled high blood pressure, this may increase the risk of death by 62% from any cause. It will increase it by 123% from cardiovascular disease and 119% and like heart diseases and like others and heart attacks and stuff like that, and 201% from stroke. Uncontrolled blood pressure is one of the most important risk factors of you getting a stroke. So if you have high blood pressure, you need to make sure it's controlled.
Tell us again, Dr. Omar. I got people
Yeah.
that won't start their blood pressure medicine just because the doctor said high, they don't feel any symptoms. Tell them again, blood pressure got to be controlled. Tell them again.
Yeah.
Need to be so actually like when I was studying in my medical school, the high blood pressure, we were calling it like the silent killer because you do not need to have symptoms from the blood pressure. The issue was your body start getting used to it and your body start tolerate to it. So, and this toleration, like at some point it will collapse and you will start getting symptoms. And again, like if you have uncontrolled blood pressure, you have 201% increased risk of getting a stroke. This is a huge amount of risk.
Huge. That's high.
So even if you do not have symptoms, your blood pressure need to be controlled. Blood pressure, like high blood pressure, can cause like cardiovascular disease. It causes kidney disease. You may end up on dialysis because of high uncontrolled blood pressure. You have a stroke. Strokes are a very bad disease, which make you paralyzed. You'll end up nursing home facilities, and it really affects everyone in your family. So I would say like controlling blood pressure is so easy, just like one pill or two pills. You take it every day, and it just almost like fix the issue and you like control your blood pressure. The other thing also, the cholesterol, like if you're having high cholesterol, basically it will just block your arteries and you will start getting symptoms. And we have a very good medicines nowadays to control it. Same for diabetes. You will not get symptoms immediately. You can have symptoms up to like 5 to 10 years after the diabetes. If you can control diabetes, this is also like really important. The other thing, when you see a physician, they will start you on some medicine, like, of course, I would assume most of you guys know like statins, aspirin, but again, you need to see a physician to start you on these medications. So the next question is, who should we screen for, or who should we think about, okay, what we should do for the cardiovascular risk? I mean, every patient coming to the clinic, you should keep in mind like what kind of risk they have. We have a calculator which we use and tell me exactly, like give me an idea what is your risk of getting cardiovascular disease in the next 10 years. And it further classified the patients to low or borderline risk, intermediate risk, and high risk. And as you go from low to borderline to intermediate to high, our approach of management change. We have some blood work to do. Like whenever you see a doctor, especially, usually they will check your blood cholesterol, but nowadays we have actually more blood work to do, as like something called high sensitivity C-reactive protein, which tell me what is the level of inflammation in your body, and based on it, I can determine like if you are at risk of cardiovascular disease or not. The next important one, which I think there has been a lot of advertisement about it, which is called lipoprotein little a. Even when I'm scrolling on my Facebook or my social media, I'll be getting like advertisement about this now. The important thing about lipoprotein A, let's say if you have a family history of your mom or your dad or your sibling had like heart attack at young age, like let's say age 40 or 30, that's mean they may have some, this is like kind of abnormal, I would say, like, I mean, like, it is not typical. So at this time, at this moment, we will start to look for like, I would say like less common things. One of these are lipoprotein little a. And I remember I was like actually like shadowing a doctor at Johns Hopkins, and he told me any patient who's coming with heart attack, we'll check this molecule for him just to make sure we're not missing anything. And the bad thing about this, actually, unfortunately, it is mainly genetically determined. So it is, when you look at different data, like African Americans usually have higher levels of this molecule than, for example, the white population. So we need to keep our mind like always like thinking about other stuff too and checking other stuff too, especially if you have family history, as someone mentioned before. If you have like significant family history, I'll be more aggressive ordering like more tests and checking you for other things like other than the usual stuff. Anyone have any questions so far? Or actually, you know what? Let me go through this because I'm almost there. The other thing which we can use is do imaging. There is nowadays something called coronary artery calcium score. Again, this is for people who are asymptomatic. Like if you do not have a history of heart disease, you are still like in the primary prevention zone. We can do like a CAT scan, and I will check for the calcium. Like, do you see all of these white like blacks in the? This is the one of the heart arteries. So you see all of this like white blacks. It's actually calcium in your artery. So the more calcium you have, the more it tells me you are at risk of getting like heart attack, or not heart attack, like coronary artery disease in the future.
Oh, okay.
So, and actually, when I do it, it gives me a certain score. If this is score more than 100, I would know, okay, you're kind of higher, kind of like of risk of getting like more risk of getting disease. If the score is more than 300, you're at more risk. So I would be more aggressive with you, like giving you more medicine and stuff like that, and make sure your cholesterol is controlled. But let's say you did like a calcium score and it came back 0, like you have no calcium in your arteries. This actually, we can comfortably say if everything else you don't have other risk factors, I would say, yeah, it is less likely if you will get a cardiovascular disease or heart attack in the future. In the near future, of course, everything changed. So this is actually a new imaging which we have been using to further classify like cardiovascular disease risk. But again, this topic is so huge, I would say, and there are a lot of pieces which, as a physician, we collected together to give you a recommendation about what kind of medicine you need to be on. But I mean, again, this is a brief introduction. I will say I couldn't cover everything because I know I have only like 30 minutes. But I would say it's a good start for you guys to know about what we have, like, or what we can do for you to help you to get better and feel better. And for medications, I brought like, we have a lot of medications. We have a lot of cholesterol medications. We have a lot of high blood pressure medications. We have a lot of new weight loss medication. So I would say we have tons of like a lot of ways to help you, as long as we're willing to work together and help you get better. So now we can go for any questions. I'm sorry if this was a long.
No apologies.
No,
we
it was
thank
great.
you. You've done excellent. Thank you. Let's first give them a hand. Thank you so much, Dr. Omar.
Thank you, doctor.
Very
Thank
Thank
you.
you.
Oh, it was
Thank
great.
you.
Thank
Thank
you.
Who want to
you
ask
so
questions?
much.
Any questions that we have? Anyone have any more questions? It can't be case specific because there's so many other factors. He doesn't have time to get into all. It's so much. They got to look at everything about you to give you recommendations or what they want to do. You just can't ask an isolated question and have a doctor diagnose you. It doesn't work like that. It's
Yeah,
looking at a complete clinical picture, knowing
right.
all of your disease states, knowing your kidney function, knowing your. It's a whole lot that's going on mentally in the brain that you don't understand the conversation that medical professionals are having before they say, you know, what it is and do this and do that. So you can ask general type questions because you're going to need a referral to cardiology from your primary care doctor for a case specific question. Okay.
If someone,
Dr. Hillard, Dr. Omar, Dr. Hillard,
Yes.
Yeah.
Hey,
is
Tony.
it true that a certain kind of foods you should eat
He went over
regularly?
diet. He did go over diet, but if you want to do a small recap on cardiovascular beneficial foods like the vegetables, fruits, and low fat, if you want to go over your diet points, your lifestyle modification on diet, do you see it, Deacon Monroe, Minister Deacon
Yeah, I
Monroe?
see it right. Yes, I'm looking at it now. Yeah.
So I mean, there are a lot of diets. You can use the plant-based diet, basically, which you eat mainly like plants, and stay away from like the protein. Or you can do the Mediterranean diet, which actually the studies show is very promising diet in reducing the cardiovascular disease. And again, I mean, like it focuses on the vegetables, fruits, whole grains, good kind of fats like olive oils. Stay away from butter and all of this saturated kind of bad fats.
You can Google the DASH diet. You can Google the Mediterranean diet. All of that's also on the Heart Association's website. So this is things that we've discussed a lot of times. So we're going to move to the next question. Who else has a question? Because I have to let him go. He works a bunch of different shifts.
I don't have any questions.
While y'all sleep at night, he got to go to work.
Thank you for coming.
Thank you so
Thank you.
much.
So much.
Thank you so much,
much.
Dr. Omar.
Thank-
We're so appreciative, and
Thank you.
Yes.
I will be talking to you. Thank you so much.
Thank
Love you
you.
all. Everybody have a good night. Thank you, Pastor. Good night, everyone.
Good
Thank
night.
you.
Good night.